الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين سيدنا ونبينا وحبيبنا محمد صلى الله عليه وعلى آله وصحبه وسلم تسليما كثيرا. Inshallah ta'ala, we want to continue today our series of Fiqh of Fasting, and today we are continuing a session that we started yesterday of the acts that and the matters that invalidate the siyam, the fasting. And we have gave that introduction, so we're continuing today, inshallah ta'ala. So, inshallah, so far what we have talked about yesterday and of what we will talk about, I will indicate to you what is disagreed upon and what is unanimous, that of agreement of the scholars that it will invalidate. But we will always in the class take the cautious opinion of avoiding any act that has been disagreed upon. Okay, inshallah. So we covered the intercourse yesterday as the very first act, and we covered eating and drinking, and we said that those all come from the Quran, from the verse of Allah subhanahu wa ta'ala in Surah Al-Baqarah that we have stated, which is verse 187. Now, besides that, it will be derived all from the hadith of Prophet Muhammad sallallahu alaihi wasallam. Now, anything today we want to cover after intercourse, after eating, drinking. Today, number 4, we would say anything that is similar to eating or drinking that brings energy. You know, the whole idea of eating and drinking is that it brings you energy. It nourishes the person, and it brings that nutrition and what have you. And that is, some scholars have said that anything that would do the same, it would take the same hukum and ruling. Let's give an example. Examples of that would be like transfusion, for example, where transfusion of blood, that is, let's say someone receives, a fasting person receives all that amount of blood, such as if he bleeds heavily and is giving a blood transfusion, for example. This invalidates the fast because blood is formed from food and drink, because we're talking about heavy amount of blood, and it replaces what it means by food and drink. Second example, for example, we can say receiving, let's say, needles or via needles, some fluid inside the body that actually that actually provides nutrition, and that it would replace eating and drinking. So a person can be on these fluids for days and weeks and they're fine. So it replaces the meaning of food and drink. That's another example that we brought. Now, that doesn't mean that every injection invalidates the fast, by the way. So we want to be very careful, because with that, with regard to, let's say, injections which do not replace food and drink, rather they are just administered for the purpose of medical treatment or for the purpose of vaccination. These do not affect the fast. So we did talk about, like, for example, COVID vaccine. It doesn't, because it doesn't provide any kind of nutrition. Second, it's in the muscle, but being in the muscle is not an issue, even if it's in the vein and it does not add any nutrition to the body, then we should be all okay. So we want to know now, the key word is that it replaces food and drink. Is this something agreed upon? No, it's not agreed upon. What's agreed upon, by the way, as we said yesterday, is any object that goes through the normal path and the normal passes that Allah subhanahu wa ta'ala created for us, that it's an opening, like the mouth, through the throat, eyes, liquid can go through the throat, nose, these are all opening that if you sniff in something or drop something of liquid, and it can easily go down the throat. That's agreed upon among the scholars that it invalidates, especially when you know that it's going to go through the throat and you have no choice but to swallow it. Now let's talk about masturbation. So masturbation is another thing that would invalidate the siyam. Okay, so what's the proof for that? We did yesterday mention that anything that a fluid that goes out of the body is with shahwa, with desire, that invalidates the siyam. Now a question would come: if a person actually starts to masturbate and stops without ejaculating, for example, without discharging that sperm fluid and what have you. So, what is the consequences? First of all, we are saying that the person is doing a wrongful act, and it's a sinful act because he's really risking his siyam. So he should not be doing it. But if he did it and it did not come to a point where he has his arousal and did not really discharge this fluid, then um he has just to repent, but his fast is still valid because it did not trigger what to us defines of invalidation of the siyam. So his fast is still valid, and he does not have to make up that day later because he did not ejaculate and he did not discharge that fluid. But we want to be very careful when we say this. We're just studying fiqh rules. We're not in no way saying that this would be okay for people to have it as a habit and a trend as long as they do not ejaculate or discharge that fluid out. No, it's a sinful act and it should be avoided, and that's why we are saying that it requires repentance if it happens. Now, what about the hujama? Hujama, which is the cupping, and we said that this is not something that disagreed upon. Inshallah, after we finish all these, we will summarize so you would know what's agreed upon among the scholars and what is not agreed upon, so you can distinguish this is like for sure, and the other ones where you maybe have room for some people that you feel that we might use the disagreement in order to give them the right answer if they need to repeat the fast or not. طيب. So we said about the hujama, which is letting blood out by means of cupping or something similar to it. Something similar to it would be donating blood during fast. What's the ruling on that? So let's see. If the blood that is withdrawn is regarded as being small amount of blood, let's say a blood test, you have to have a blood test during Ramadan, and you honestly don't want to risk the whole day. I don't want to break my fast during Ramadan. So would that invalidate my fast? The answer is no, since it's just a small amount as a sample to have the blood test, and it's not something that is even close to the cupping or like with the blood donation and what have you. طيب. So if so to put them into categories, let's read it one by one, inshallah ta'ala. So if the blood that is withdrawn is regarded as being a small amount for blood test, then this procedure does not invalidate the fast. Okay. What about if it's a lot of amount? If a person donates blood, so that's the rulings of blood donation during Ramadan and during fast, and a large amount is taking, that invalidates the fast by analogy. So we're making qiyas here. We don't have like a specific hadith or ayah about blood donation, but we're using analogy, qiyas. So we're making analogy with hujama, with cupping. Remember, yesterday we talked that Prophet ﷺ did say that the one that does the act of hujama, that does the cupping himself to other person, and the one that receives the cupping, both of them, Prophet Muhammad ﷺ said that the fast is invalid. So it's by analogy with cupping, which refers to the act of letting blood flow from the veins and discharge outside of the body. The hadith for this and the evidence is that Prophet Muhammad sallallahu alaihi wasallam said that the cupper, the one that does the act, and the one to whom cupping is done or receiving the cupping service, both break their fast. That's what Prophet Muhammad ﷺ said. So that's why we wanna avoid that. So if that's the case, so we say why? So we did talk about that the majority of scholars do not see hujama. The reason why is because it was reported that Prophet Muhammad ﷺ did hujama while he was fasting. So they wanted to know that this is more of a, they wanted to combine them together, and they said, well, this is says no, and this says, and this action says yes. So to bring them together, they said it's a disliked, makruh act. But the Hanbali school, Imam Ahmad says, no, it's not disliked. It is not allowed, and it does invalidate the fast. So what we will adopt in the class here is that we will avoid it and consider it that it invalidates. Why? Because we want to be on the cautious side. We don't want to take, since the majority of the scholars says makruh is disliked, there is really no urgency to do it during the day. If it has to be done, let's do it outside of the daytime. So it could be done at night, inshallah ta'ala. Okay. So it's not urgent, something like the blood test that we said, it's the only appointment that you were able to book was during the month of Ramadan. And it's a very small amount for blood test that is withdrawn. So it's not, we cannot make analogy to hujama that really gets a lot of blood, out of the body and discharges out of the body. طيب. Let's see now. Anything else about hujama? Bismillah. Yeah, that's it about the hujama. So let's talk about now vomiting, like intentional vomiting. So intentional vomiting, Prophet Muhammad sallallahu alaihi wasallam said, whoever vomits involuntarily does not have to make up the fast. It's unintentional. It just happens. A lot of people have acid refluxes and they end up like having no choice. It just with that, they just unintentionally they just end up vomiting. So they're not really doing anything to actually cause the vomiting itself, the act of vomiting. So Prophet ﷺ said, whoever does that does not have to make up the day. However, but he said, Sallallahu Alaihi Wasallam, but whoever vomits deliberately, let him make up the fast. The one that does it on purpose, because it relaxes him, it gives him comfort, it just empties the stomach so he doesn't have the feeling of a turned stomach, that feeling of of turned stomach feeling and what have you. So now about the ahkam and ruling of the menstruation, monthly cycle, and the post-birth rulings, the bleedings. So those again agreed upon among all the scholars. Prophet Muhammad ﷺ said, it is not the case that when she gets her period, she does not pray or fast. So that's the proof that prevents a woman from. So the ruling now, if somebody asks, could she end up actually fasting? Can she just fast and what have you? The answer is no, because Allah subhanahu wa ta'ala said no, then she cannot fast. Some people will ask, even if the days are not counted, just to feel, the answer is no. Allah subhanahu wa ta'ala, like Allah subhanahu wa ta'ala wanted us to refrain from eating and drinking, Allah subhanahu wa ta'ala wanted her not to refrain, meaning that, of course, we're not going to go in public and show off that we are drinking and eating in front of everyone. But she should not prevent herself from what Allah subhanahu wa ta'ala allowed her. Okay, so now let's take some examples. When a woman sees the blood of her period or nifas, the post-birth bleeding, her fast becomes invalid. So let's say she started the day very fine, and toward the end of the day, just 1 hour or even few minutes before the sunset and what have you, and her period starts, it invalidates that day. The second the blood is out and discharged, the fast is invalid. Okay, but the opposite is true as well, meaning that if a woman feels that her period has started but no blood comes out until after sunset, her fast is absolutely valid. Remember, our indication and what defines is the discharge of the blood. Somebody questions will ask, how about spotting? So if it is spotting that is coming before the actual period, that she knows that she always gets those spotting before her period, always. So she has, some women have it, mashallah, yani, very consistent, and they know it very well. So yeah, that spotting is considered to be a blood, right? A blood from period, but it's just coming out as spotting and then it just floats. So that would invalidate the fast, yes. However, if it's a regular period, really she doesn't have any regular period, it's on and off and it's different days and it's different dates, and sometimes she gets spotting and the actual period never shows up except after many days later. So there is really no indication. So the spotting is not going to invalidate her fast. She will just continue with that until she actually sees the flow of blood that she is familiar with, that pertains to her monthly cycle. Okay. Now, another question would be, is it preferable for a woman to keep to her natural cycle, to accept that which Allah subhanahu wa ta'ala decreed for her? This question comes is about the permissibility of taking some pills to prevent the period from coming during the month of Ramadan. Of course, the scholars cannot say it's haram. They cannot say taking some pills that would prevent, because it's not damaging. However, it's just delaying. But then again, the scholars say there is no need to do that. This is the nature of creation. Allah subhanahu wa ta'ala created our women to go through this, so it should take its natural course. Especially the scholars see it as disliked and sometimes to the level of haram if this was tried before and those type of pills mess up her body and causes a lot of side effect to her body and to her period and to the chemical imbalance inside her body, which causes many other side effects in her life, in her mood, in the way that she deals with her spouse, with her children and what have you. Then by all means it might be a disliked, and then it might go to a level where it's haram to do it. So we would say it's preferable for a woman to keep to her normal and natural cycle and to accept what Allah subhanahu wa ta'ala decreed upon her. If the period comes during Ramadan, alhamdulillah. If it doesn't come, also alhamdulillah Rabbil Alameen, it's all good. Now, we want to note that so far, what we talked about, those acts invalidate the fast. Uh, in order for us to say, we're going to just repeat that it invalidates the fast. Besides, of course, the monthly cycle, which is something that is beyond her control, right? It comes beyond her control. The bleeding that comes after birth, the post-birth bleeding, the nifas, it's out of her control. That's the only act that does not require the three conditions that we spoke before, which is that the intention to break the like the ignorance. They didn't know any better. They didn't know the ruling. So we talked about those um, uh, yesterday. So that's still valid. So we just wanted to know that all the above matters are things that invalidate the fast, all of them, apart from the menses and the nifas, only invalidates the fast if they're conditioned. So everything else beside menses and the nifas, the three conditions have to be met. The person is aware of the ruling and knows it's haram but does it anyway, and not ignorant of it, and that he did not, and he did it, I'm sorry, he did it knowingly and not out of forgetfulness. So they knew that they were, like we shared the story of the Sahabi, that he knew that he was doomed because he did something wrong, and that he did it by choice and was not forced to do it. So again, there is no lack of knowledge. There is the it's not out of ignorance. They know the ruling, and then they were not forced to do it, so they did it willingly, and not and the third thing is that they did not, it's not out of forgetfulness. It's not like they forgot or something. Let's talk about some of the common things that relate to our subject that many people ask whether it invalidates. So we want to talk about things that are mainly asked about, that we will classify in general with some disagreement, but in general, without going into details, that it would not, the overall ruling, it would not invalidate the fast. Let's talk about eye drops, ear drops, tooth extraction, treatment of injuries. In general, do not invalidate the fast. Medical tablets that are placed under the tongue to treat, for example, asthma attacks or what have you, so long as it does not get swallowed, or whatever that residue or that whatever it has is not something that you feel is an object. It's like something that has a weight, or that has a touch to it, that you can feel it inside your mouth and then swallow it. Okay, insertion of anything. So this is especially for the sisters when they go to their doctor, female doctor, to do their physical test and what have you. And again, it happens that the appointment happens to be during Ramadan. So remember when we said that when we allow things to come into our body or discharge, there is a question mark whether that would invalidate the fast. But we were specifically talking about intake of things, and then discharge of fluid and what have you, because that's the only thing that you can discharge, is mainly fluid, whether it's through vomiting or ejaculation and what have you. Now, with her physical test and what have you, inserting object uh, in her body would not invalidate the fast, inshallah. It's something like an example of that would be the IUD, or even for that matter, if the doctor, her female doctor, has to test her and insert that IUD or what have you, it does not invalidate the fast, inshallah. Anything that enters the urinary tract uh, of a male or a female, inshallah ta'ala, like a catheter. Somebody really had to go to the emergency, and because they just can't go to the bathroom and they just cannot let go, cannot urinate and what have you, but they're fasting and they're asking, really, if I don't need to break the fast, I don't want to break the fast. And they do insert that object in order to allow them to be able to use the bathroom normally and what have you. It should not, inshallah ta'ala, invalidate the fast. And many things that are similar to it, okay? Like any medical scopes that, a scope that they monitor, they see things and whatever. So, inshallah ta'ala, that should not be of an issue. Same thing goes with going to the dentist, of fillings and extractions. Of course, some scholars say extractions, it all depends. That's why I said without going into details. Remember, now you have the formula. If it's major blood bleeding and losing a lot of blood, then it becomes very similar to the hujama and whatever. So that invalidates. If it's just small amount of bleeding, then it would not. So now you know the rules and you apply to it, inshallah ta'ala. Now, rinsing the mouth, gargling, uh, like medical medicine sprays that, for the gum or for the mouth in general, what have you. As long, again, the formula for you, as long as it's not an object, it does not accumulate to become an object or a fluid that has a weight to it that you can feel it, and you do not swallow it. That's very important. So as long as it does not reach the throat and goes down to the stomach. And many examples when people go to the hospital, if they have to get on the, like, if they have to take oxygen, if they, anesthesia and what have you, numbing any place of the thing, if that should not be an issue, inshallah ta'ala. As long, and you know the formula, as long as it doesn't come in a form of a food and a drink. What about things that may enter the body through absorption, like through skin, like cream, something similar to creams and what have you? Would that invalidate? The answer is no. Insertion of a fine tube via the veins and what have you, for diagnostic, for imaging, for all that, treatments and what have you, for the heart, that is mainly, or any part of the body, it should not, inshallah, invalidate. So that gives you an idea of things. What about taking samples from the liver or any other part of the body? Again, so long as that is not accompanied by any kind of administration of solution that ends up you having to swallow that in order to take that imaging and that test and what have you, then you should be okay, inshallah ta'ala. And many other questions that are very similar to this. So now you have the formulas and it can be applied to it, inshallah ta'ala. And with that, this should give us a very good idea about things that would invalidate, things that are agreed upon, and things that are not agreed upon. So, inshallah ta'ala, next Monday when we meet, we will gather all this together to go through, again, very quickly recapping of what's agreed, upon, what's not agreed upon, and what we should avoid, and what have you. And then I will add to it things that are maybe not very realistic or not very it doesn't happen, but then as a student of knowledge we have to record it and we have to have it, and sometimes it does happen to people, so you have the knowledge. Example of that: somebody puts something that doesn't have any food or anything, just actually an object, very small smooth object, solid object, so it's not even food, put it in a mouth on purpose and just swallow it. I know it's not really realistic, but then the fuqaha has to go through this to indicate something, to tell if someone actually does it. Someone loves to play with things, put in their mouth, and they keep to play with it, and they say it's not food. I just like to keep things in my mouth and to play around with that object, like a toothpick or whatever, or something similar to it, and they end up actually swallowing that. So we want to know some of these rulings. It's not a frequent questions that we receive, but then you should just have it. And that would, inshallah, conclude this section of invalidation, matters that would invalidate the fast, inshallah. And that should do it, inshallah ta'ala, for today. Jazakumullahu khairan wa barakallahu feekum, inshallah ta'ala. I do apologize for not sending you the notes. It's on my part. Alhamdulillah, Sister Sina is doing an excellent job of sending them day by day, but I'm supposed to just review them and inshallah ta'ala send them to you. But it's a very tight schedule daily with Ramadan, but inshallah it will happen, inshallah. Jazakumullah khairan wa barakallahu feekum. Assalamu alaikum wa rahmatullahi wa barakatuh.